Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute, Hyderabad. In previous video, we discussed about varicocele, what a varicocele is, how it affects sperm fertility, the male's fertility and testosterone production. So now in this video, we'll discuss about grading of varicocele. That means how many types of gradings are there and how to come to a diagnosis and when to come to a diagnosis, when to come to a conclusion that this particular patient needs surgery. In varicocele, there are two types of gradings. One is clinical grading, second one is ultrasound grading. So now in clinical grading, by the time we can examine the we can palpate or examine the varicocele, or we can see the varicocele, that is grade 3 varicocele. Generally grade 1 and grade 2 only when you examine and when we make the patient to cough, there you can see the reflex, and based on that you can find out that there is varicocele. But clinically grade 3 varicocele means the moment you see a man's scrotum, you can say he has varicocele. You can see bag of worm appearance. Bag of worm appearance in the sense like if you put some kind of worms or noodles in a plastic bag, the kind of appearance what you see is bag of worm appearance. But ultrasound wise there are different gradings: grade 1, grade 2, grade 3, grade 4, grade 5. So this grading is depends on what is the vein size, how many veins are there, and when you cough or whenever when you try to put effort on the stomach, we call it as Valsalva maneuver. During Valsalva maneuver, what is the diameter of the vein which has increased from the normal size? All these are considered in ultrasound gradings. So now if grade 1 means it's only in the early stages, grade 2 means the number of veins, if it is more than around 2 to 3 mm diameter, then it is called grade 2. If it is more than 3 mm and multiple veins are there, then it is grade 3. And what are grade 4 and grade 5 is the presence of varicocele. Varicocele veins can be present above the testis, parallel to the testis and below the testis. That means we call them as basal veins. So now it depends where the veins are. If there are only in the cord, there is one classification. If it is in the cord and parallel to the testis, then it is one, and even basal veins are there, then it is grade 5. So don't get confused between grade 3 in clinical grading and grade 3, grade 4, grade 5 in ultrasound grading, because both are same, but only for the interest of the surgeon, where the veins are there during the surgery, which veins has to be ligated, your ultrasound grading will tell us. So on the whole, if it is grade 1 varicocele, generally we don't have to operate. Whether it is clinical grading or ultrasound grading, we don't have to operate. If it is grade 2 on both sides, then this has to be, we can wait and watch, we can put them on medications. Then if they are responding with medications and if they say, doctor, we want only one child, then you don't need surgery. But in grade 2 varicocele, bilateral grade 2 varicocele, if sperm parameters are very low and testosterone levels are very low, then this has to be operated. If it is grade 3, that means it is already in the maximum stage. So the level of damage, generally if it is grade 1, there is only 20% damage. If it is grade 2, there is 40 to 50% damage. If it is grade 3, then there is 80% damage in the testicular tissue because of the carbon dioxide related blood flow. So now all grade 3 varicoceles, better it has to be operated. What kind of surgery has to be done, when it has to be done, all these things we'll discuss in next video. Keep watching. Goodbye.